Radiation therapy. Radiation therapy, also called radiotherapy, uses high-energy X-rays or other particles to destroy cancer cells and prevent them from growing and dividing. Radiation therapy is often used in addition to surgery or chemotherapy to increase the chance of destroying any remaining cancer cells in the body. It may be used in the following ways for treating mesothelioma. External beam radiation therapy. This is the most common type of radiation therapy for mesothelioma. It delivers radiation from a machine outside the body to the cancer site. The radiation is carefully targeted at the malignant tumor. This therapy is often used to treat mesothelioma that has spread to other parts of the chest or to relieve symptoms such as pain. Brachytherapy. For this form of internal radiation therapy, radioactive material sealed in needles, seeds, wires or catheters is placed directly into or near the cancer. Brachytherapy is not used often for treating pleural mesothelioma but may benefit some patients with certain cancers elsewhere in the body. Proton beam therapy. This type of external beam radiation therapy uses protons rather than X-rays to treat cancer. Protons deposit most of their energy at a specific depth in the body, minimizing radiation damage to healthy tissues between the proton source and the tumor. Proton therapy may cause fewer side effects compared to standard photon radiation for some children. It is being studied for use in treating difficult cases of mesothelioma. Photodynamic therapy, PDT. For PDT, a light-activated drug is injected into the patient's body that accumulates more in cancer than healthy tissues. A laser or other special light is then used to activate the drug, which damages nearby cancer cells through a photochemical reaction. PDT may help mesothelioma that invaded the chest wall or diaphragm. It can also be used to relieve symptoms such as pleural effusions. Chemotherapy. Powerful anti-cancer drugs can be put directly into the chest through a tube or port, called intrapleural chemotherapy, or through intravenous administration. Intrapleural chemotherapy delivers high concentrations of drug directly to the cancer site. The drugs currently used for mesothelioma chemotherapy include pemetrexed, Alimta, cisplatin, carboplatin, gemcitabine and raltetraxt. Drugs are often given as a combination chemotherapy regimen to improve their effectiveness. Research is evaluating new drug combinations and targeted therapies as well. Some ways chemotherapy may help control mesothelioma include shrinking tumors that cannot be completely removed by surgery, killing any cancer remaining after surgery or radiation to help prevent recurrence, palliative treatment to relieve symptoms and improve quality of life for people without resectable disease, inducing remission in early-stage disease to potentially extend life. Targeted drug therapies. These are medications that interfere with specific molecules, usually proteins, involved in tumor growth and progression. Some targeted therapies being studied for mesothelioma include angiogenesis inhibitors. These drugs target new blood vessel growth that tumors need to progress and spread. Bevacizumab, Avastin, is a monoclonal antibody against vascular endothelial growth factor, VEGF, that is being studied. Epidermal growth factor receptor, EGFR, inhibitors. Cetuximab and gelatinib target EGFR expressed on some mesothelioma cells. Multi-targeted kinase inhibitors. These block several receptor tyrosine kinases that tumors use for growth signals. Nintedanib and srofimib are two drugs of this type being researched. Programmed death ligand 1, PDL1, inhibitors. Drugs like nivolumab and pembrolizumab block the PDL1 don't eat me signal on tumors that helps them evade immune system attack. Histone deacetylase, HDC, inhibitors. Varinostat interferes with DAC enzymes that modify chromatin and help turn genes on and off abnormally in cancer cells. Folate antagonists. Pemetrexed interferes with folate-dependent metabolic processes critical for cell replication. It is commonly used chemotherapy for mesothelioma. Multimodal therapy. This strategy combines two or more treatments. For example, some mesothelioma patients may have neoadjuvant chemotherapy or radiation therapy before a surgery like PD or EPP to shrink tumors and make them easier to remove. Others may get chemotherapy and radiation together after surgery to eliminate remaining microscopic disease. By attacking the cancer with multiple weapons, multimodal therapy may provide better overall survival compared to single therapies alone. Supportive care. Managing symptoms and pain that mesothelioma causes is very important. Interventions like oxygen therapy, draining fluid accumulations, radiation to painful bone metastases, medications and occasionally minimally invasive procedures can greatly improve quality of life when curing the cancer is no longer possible. Palliative care focuses on relieving suffering and supporting the best quality of life possible based on an individual's goals of care. Immunotherapy, drugs that boost the immune system's ability to fight cancer. Different immunotherapy approaches being developed for mesothelioma, such as therapeutic vaccines to teach the immune system to specifically target a patient's cancer cells. So far, PD-1/PD-L1 checkpoint inhibitors have shown the most promise as a therapy. Research continues to learn how to effectively harness the immune response against malignant mesothelioma cells. Gene therapy. This new treatment approach uses genetically engineered viruses or nanoparticles to deliver DNA, RNA or genetic material into a patient's cells to fight their disease. The material may enable cells to block critical cancer pathways or boost their response to chemotherapy and radiation. Gene therapy research for mesothelioma focuses on overcoming tumor resistance. These are some of the main alternatives to extrapleural pneumonectomy or pleurectomy, decortication being explored clinically. Future directions also involve combining different treatment types and individualizing approaches based on molecular profiling of each patient's specific cancer. Overall survival is extending for some groups, though there is still more progress to make towards managing this difficult disease long term.